Hi, I'm Carey Kalmowitz.
And I'm Adrienne Dresevic, and we're two of the founding members of the Health Law Partners.
We're here today to speak about integrating imaging and other ancillary services into physician practices and some of the healthcare regulations that govern those transactions. With increasing frequency, we're hearing our physician clients across the country express a concern about a trend that makes the business of medicine more challenging. That is, the confluence of reimbursement contraction on one hand and regulatory expansion on the other. While to a great extent practice expenses continue to rise, the revenue stream to physician practices from the delivery of core medical services, with limited exceptions, often is stagnant or declining. We see this each year with the Medicare physician fee schedule, with proposed cuts followed by 11th hour restoration of payment. And docs are experiencing flat or declining rates from other payors as well. This reimbursement softness has triggered an interest among many physicians to integrate imaging and other high-value ancillaries into their practices. And this, unfortunately, is the point at which physicians begin to understand how the complex network of healthcare regulation may restrict their ability to structure these transactions.
All of these regulations present unique challenges for healthcare providers, weighing economic considerations with the transaction with the significant legal risks inherent in many healthcare transactions. For example, physicians all across the country that are furnishing advanced imaging services in their offices, such as CT, MR, nuclear medicine, need to do so in compliance with the Stark in-office ancillary services exception. Now, arguably, this is one of the single most important exceptions to the Stark law. Without it, these physicians would be unable to provide these type of services in their office because they'd be prohibited from doing so under the federal Stark law. The in-office ancillary services exception contains many requirements, such as the supervision standard, the location standard, and the billing standard. All of these requirements present some unique issues for particular arrangements. So physicians and other providers of imaging services need to ensure that the entire arrangement is structured to comply with every unique aspect of the regulation. What is really important for physicians and other imaging providers to keep in mind is not only do they have to structure their relationships to comply with the Stark in-office ancillary services exception, but also Medicare has been significantly revising the reimbursement regulations, which also directly impact the way an imaging arrangement or other diagnostic testing service arrangement must be structured.
I agree, Adrienne. While in most transactions the parties at the outset have a relatively strong idea as to how they want to structure the transaction, Adrienne, when you and I are brought in to help with these transactions, what we like to do is to incorporate sufficient structural safeguards to make the deal compliant, while at the same time we have to be sensitive to the business objectives that underlie the party's decision to enter into the transaction. And we've seen this in the diagnostic imaging area, where some of the transactions have had to be reconfigured to comply with the anti-markup rule. You've written extensively on this area, both with respect to the requirements to meet both the TC, the technical component, and the PC, the professional components.
Yeah, Carey, often what we see, for example, would be physician practices that are contractually engaging radiology groups in which the radiologists are providing services off-site. They're providing the professional interpretation and report off-site, which is presenting somewhat of a problem for these physicians moving forward under the anti-markup rule.
In our experience, it was a common practice for physician groups to contract with an outside radiologist for the professional interpretation and then for the group to bill for that PC.
Right, and then oftentimes in these arrangements, the radiologist would be providing these services off-site, which may have presented a problem under the federal Stark law unless they were employed by the group. But now, as of January 1st, 2009, really presents an issue for most of these groups under the anti-markup rules, payment restrictions.
In addition to some of the anti-markup rule considerations, physicians have asked us whether under these new IDTF regs, it's permissible for a physician group to purchase the equipment and the technicians from a mobile leasing company and then to bill for the technical component of that diagnostic imaging service.
Well, Carey, if it's structured appropriately, the physicians can continue to bill for that technical component of the service if they're under a common leasing arrangement with the equipment and the technical staff. Where the problem will arise is whether the leasing entity is providing the physician supervision. If not, which is often the case, the physician group provides the supervision for that technical component of the service, the physicians group can continue to bill for that service.
Adrienne, obviously there's a lot of complexity to be able to structure these transactions in a manner that's compliant. But nonetheless, it's important for physicians to know that although their options aren't limitless, that there still exist opportunities to be able to generate significant revenue from diagnostic imaging and other ancillary services. But you have to be attentive to structuring it in the right way. And the anti-markup rule, the anti-kickback statute, the Stark law, the IDTF regs together really place some significant limitations. So you just have to show great finesse and sometimes some great ingenuity in the way that you structure it. But meanwhile, these opportunities still do exist.
I think you're right. We're seeing a lot of the arrangements in which we're able to carefully navigate all these regulations and structure things to comply with the Stark and kickback, anti-markup, and any Medicare regulations, while trying to get the parties to the same place that they may have been economically before some of these regulations. So it's a balancing act we see in our practice every day, but we're able to creatively structure transactions that will withstand regulatory scrutiny.
We hope that you found our remarks insightful as to how you can continue to structure some of these transactions. And please visit our website, www.thehlp.com, for more articles on these and other areas. And please feel free to call us if you can use our help with structuring these transactions.